Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, and again we have Dr. Ben Miraglia with us to continue our multi-part series on jaw development and sleep and breathing and how this all ties together for optimal health. Ben, welcome back.
Thanks for having me, Hal.
Today we're going to talk about some different co-morbidities or different things that can happen to our bodies, or different ailments that are a result of poor sleep, which is a result of poor breathing. And many parents in my practice come seeking solutions because their child is wetting the bed. And the technical name for that is enuresis. I've seen kids as old as 20, in their 20s, that are still I say kids, young men and women that are still doing this. Mostly it affects kids that are in their, before the age of 10, 12. But this is a huge problem that I was not even aware of until I really got into breathing and functional airway. But it is a big problem, and the kids it can really make them social recluses because they don't want to go to a sleepover. They don't want to have to put pull-ups on when they're 12 years old because they might wet the bed. And if they do wet the bed, they're at their, friend's house. So it's a big problem. And Ben's been treating kids for almost 20 years. So he's seen a lot of this. I'm sure he's got a lot of really good stories and a lot of victories that you've seen with kids. Just in the few years that I've been doing this, we see what a difference it makes. So why don't you explain, Ben, to us what happens to make a child or an adult, wet the bed on a chronic basis?
Yeah, so this is, going back a ways, I didn't even know this existed. And then all of a sudden, over time, you start putting pieces of your puzzle together, and then you start figuring out that, hey, this is a very significant symptom that we find in people who have sleep disorder breathing. And so whether you're mouth breathing or have obstructive sleep apnea, you have some sort of breathing issue at night. And bedwetting is a very common symptom. So when we think about children in bedwetting, we could go to the CDC and get numbers. So if you wanted to look it up, you'd see cdc.org will give you numbers that say 10% of all children bedwet up to the age of 12, and they have it broken into categories. But it's a significant rate. For the last 10 years, we've been keeping track of it to try to see, like in our own private practice, it's not a research facility, but as we ask it in the questionnaire, we learn more and more of the kids who have bedwetting as a symptom. We start paying attention to, it is a very significant rate, but then we also keep track of, when do these symptoms fade away if we start to breathe better. So there's a pathway to it, so we should talk about that first. So we began with this early soft diet, delivering weak musculature that developed underdeveloped jaws for us. The underdeveloped jaws come with a bad airway. That poor airway means we don't breathe well through our nose, we're going to be mouth breathing. Mouth breathing isn't desirable. The brain tries to correct it while we're sleeping, and when the brain is trying to correct your breathing or improve it while we're sleeping, it can ruin our sleep because the brain doesn't do its primary function for us. Well, when we talked about that whole scenario of the brain switching gears to get you, let's say, breathing better, as opposed to doing all the cleaning and resetting at night, we have to throw a couple fancy words out there because we know the words fight or flight. Everybody's aware of fight or flight. So when you're thinking about fight or flight, you might think about maybe a car accident or someone jumping out at you from a dark alley and scaring you. And then all of a sudden your body's different, but it's instant. Your body starts to change and do things. So fight or flight is a mechanism for protection, and it helps you in situations that, are part of, living a long life. But fight or flight isn't meant to run all the time. Well, when we're thinking about fight or flight, we talk about our nervous system, how it's running. There are two parts to the nervous system, sympathetic and parasympathetic. And I know those are kind of ugly words, for most of us. But the sympathetic nervous system is the fight or flight one. So fight or flight, sympathetic system. The other side of that coin was rest and digest. So there's fight and flight, there's rest and digest. That's the parasympathetic system. So when you're breathing beautifully and your nose breathing through the night and your brain is working great, you're in the parasympathetic category because the parasympathetic system is running all night long. Your nose breathing perfectly. The parasympathetic was your rest and digest. That means your brain's doing everything perfect. You're digesting your food beautifully. You're going to wake up refreshed. You're ready for the day. Now, the problem with poor breathing is that you can't run them both at the same time. So when you're breathing poorly and the sympathetic nervous system gets activated, now it's elevating. There's a little fight or flight reaction to improve your breathing. When you activate the fight or flight system and you have sympathetic nervous system running, the parasympathetic shuts off. So the rest and digest goes down and the sympathetic or fight or flight goes up. So now your brain is kind of kicked into gear where, hey, I got to work on that breathing pattern and try to get better breathing. I'm in fight or flight. So there are different levels of fight or flight. There's car accident fight or flight. There's you go to the zoo and it's a happy experience and you're having a great day with your family. But if the lion jumped over the fence and landed in front of you and your family, that would be fight or flight. That's another level of fight or flight. Well, it turns out when you're poorly breathing, your sympathetic nervous system gets activated. You are now in a fight or flight response to improve that. It's not the same as a car accident or the lion being in front of you about to eat you for lunch. You will do your best, right? But we're going to lose that battle. But the idea is when you have poor breathing at night, your sympathetic nervous system's turned on. You're in fight or flight. Now, when you get into fight or flight, it changes your body in an instant, but it has to do so by shifting things around. So let's think about the lion at the zoo. The lion jumps over the fence. All of a sudden, you are going to be very alert and very strong. Your upper body musculature, you're going to get in the big muscle groups a flood of blood and oxygen to put up your best fight or flight for an amount of time, 30 seconds, 1 minute. But you didn't get that flood or extra oxygen because you took a bigger deep breath. It took it from other parts of your body. So what fight or flight does is it instantly takes away from things you don't need to provide it for things you do need. So you could run differently. Well, if fight or flight is activated because you're breathing poorly, it means that you're going to have a shift in blood and oxygen redistribution going on. So what if you took a little oxygen out of the urinary system, digestive system, reproductive system? All of these things are part of what's running you normally. So instead of resting and digesting, now you're in fight or flight. If you have a shift of oxygenation to the larger muscle groups, well, if you pull some of the oxygen from the urinary system to deliver to the larger muscle groups, well, now the urinary system might malfunction. That's a pathway where maybe bedwetting is an end result of having improper oxygenation to a system that would be running beautifully at night if you were breathing well. Now, there's also another pathway. When you jump into fight or flight, well, fight or flight, that redistribution of all of the blood and the oxygen, it takes energy to do that. You have an energy expense, so now it's pulling stores of energy to give you a boost of energy, but you're supposed to be sleeping. So all of a sudden you get this boost of energy, but in order to redistribute the blood, it changes the cardiovascular system. So what's happening? Your heart rate goes up, your blood pressure goes up. Now the heart starts pumping faster and working harder, but when your heart is working harder and pumping faster, it can elevate your body temperature. So all of a sudden it's like, hey, I'm running a race in my sleep. Well, the change in the cardiovascular or the heart system, that is like, well, now I'm not resting. I'm actually active because I'm burning fuel to feed a system to protect my breathing. Well, all of that requires energy. When you start using up that energy and now you're feeding that system, well, all of a sudden it does change how your body functions. So we've got this whole imbalance happening. Well, the urinary system is one of the first things to be taken away from the fight or flight. So you don't need to have your urinary system functioning perfectly when you're in fight or flight, so it would shut that down. So you pull the oxygen from there, you have a pathway to malfunction. But when the cardiovascular system starts running overtime, all of a sudden when you elevate your blood pressure and your heart rate, you can increase your body temperature. That's a pathway towards sweating. Body temperature is regulated by release of water, and we recognize sweating as a release of water. Well, there's another way to release water. It's urination. So there are different ways to get to bedwetting, but it all finds its way back to poor breathing while sleeping, changing and activating a fight or flight mechanism to improve your breathing, and the redistribution and changes that occur in the body can produce body heat or temperature increase where we have to lower the temperature quickly, which would mean night sweating and or bedwetting. And the other one is the redistribution of the oxygen. If you pull oxygen out of the urinary system, it may malfunction. You may bedwet. Now, in children, we see a lot of bedwetting. In adults, we see waking to go to the bathroom. Now, it's interesting because the child will wet the bed. The adult will get up and urinate. And so we say frequent urination. Hey, I get up and I urinate. You didn't get up to urinate. What happened was you were sleep fragmented. You were woken up because of your poor sleep. But when you wake up, your body didn't know you slept an hour and a half or 2 hours or 8. When you wake up in the morning, your digestive system should have worked. You're supposed to be then, okay, let's get rid of what it did at night.
Yeah.
But at 2 in the morning, you woke up from your bad breathing and sleeping. It turns out you have to go to the bathroom because your body says, oh, are we done sleeping? Okay, it's time to go to the bathroom. You go to the bathroom. You didn't necessarily wake up to go to the bathroom. You woke up because of your bad breathing and sleeping. Now that you're awake, your body's like, oh, are we done? Oh, I'll go to the bathroom. But now you went to the bathroom at 2:30 in the morning. What do? You go back to bed. I went back to bed. You go back to bed, you sleep another 2-3 hours. If your bad breathing and the fight or flight reaction wakes you from your sleep, if it's that bad, it wakes you from your sleep, your body gets up again at 4:30 in the morning. Oh, is it time to go to the bathroom? Okay, I just woke up. You go urinate again. An adult will get to the point where they urinate multiple times a night, but not they had to get up to urinate.
Yeah.
Their poor breathing interrupted their sleeping. They were woken enough. When the breathing is bad enough, it will wake you up to reposition you. So when we think about bedwetting in children, now I know after doing this for 20 years and the last 10 focusing on, children who breathe poorly, we think about bedwetting as a direct result of poor breathing at night. And because it's a direct result of poor breathing at night, we think about, well, that's our anatomy. That's the underdeveloped jaws. So I don't treat bedwetting. I treat underdeveloped anatomy. I treat malocclusion, fancy word for underdeveloped jaws. So we take a look at the kid and we start measuring and looking at the child and we decide, this is underdeveloped jaws leads to poor breathing. Poor breathing ruins your sleep. Sleep fragmentation changes how you function with that sympathetic, parasympathetic shift. Well, fight or flight at night is very bad for us, and one of those direct results is going to be bedwetting. So what we do then is we go after the diagnosis we made, underdeveloped jaws. So we treat the children by growing the jaws early. Then, of course, what you would see is that, hey, the teeth are looking better, because when the jaws are growing nicely, the teeth start lining up better, but that's a direct result of seeing, one of the teeth getting to place. The idea is, if the jaws improve, you breathe better. So if you get your jaw growth and development in place, you breathe better, guess what? You sleep better. And the moment you start sleeping better, the bedwetting fades away. So now it has been a very distinct experience over the last decade that we're keeping track of it, that it's a 2 to 8 week window. What we find in my practice, again, it's not research, I'm a private practice, but we do treat hundreds of kids a year. In 2 to 8 weeks, you can bring bedwetting down to nothing, and that child can stop bedwetting just by growing the jaws. Now, in a child whose jaw structure is kind of immature and soft, I like to talk about, we do say bones. These are bones, but when you're young, you're a child, it's like a wet sponge. You have a lot you can do with it. You can mold it like fresh Play-Doh. So if you can grow the jaws and breathe better and sleep better, bedwetting is one of the symptoms that goes away the fastest. So in 2 to 8 weeks, most kids will come out of the bedwetting, and it never comes back, because when you've delivered the jaw structure and have better breathing and better sleeping, you're done with bedwetting. So we have had the experience of kids who bedwet 5 nights out of 7 until they're 12 years old come in, and within 2 to 8 weeks of jaw growth and development, the bedwetting stops, and it is forever. So bedwetting in our world is a symptom that is downstream of underdeveloped jaws, poor breathing, poor sleeping. We go right after the cause. So I associate bedwetting having a cause of underdeveloped jaws. And I go right after the cause, develop the jaws, and it turns out that the bedwetting fades away fast.
Are there any conditions where bedwetting might not be a result of that?
So it is incredibly rare to have a condition or syndrome where bedwetting is the result. And I'll tell you my experience in the last decade of paying attention to this. I don't have a single child that has bedwetting for a different reason other than poor breathing and sleeping. And so hundreds of kids a year, not research, it's private practice. It's just a clinical dental office where we treat children. I haven't come across in 10 years a child that has a syndrome or condition or anything that other than underdeveloped jaws leading to poor breathing and sleeping that's giving them their bedwetting. Also, I was able to dig up a while ago, and this is decades ago, there was a really significant research project done on bedwetting children. And I think it was done during the 60s or 70s. And what they learned that the bedwetting community of children has the same sleep fragmented cycle as a snoring or apnea patient. And so the sleep cycles were almost identical. So they live in a sleep fragmented nighttime.
yeah.
So if you have that sleep fragmented cycle, you have the opportunity to have bedwetting as one of your symptoms. So I would say that I don't have the experience of bedwetting being anything other than poor breathing at night from underdeveloped anatomy. When we go after that, we solve it almost every kid.
Yeah. Yeah, I didn't know if there was or not. I agree with you. I'm not aware of anything. If it is, it'd be very, very, very rare.
Yep.
Yeah. So.
Yeah, one-offs, like
Yeah. Right. Right.
so
yeah.
rare we won't come across it.
Yeah.
Yeah.
My office manager's daughter is a SWAT team member in one of the communities out here around Dallas, and she was telling me when I first got into this, and I was telling her about bedwetting and the fight or flight. She said, interesting. She said a vast majority of rookie policemen and women, when they get in their first real gun battle, and they're face to face with someone pointing a gun at them, they'll wet their pants.
Yeah.
And it makes sense.
Yes.
They don't need their bladder right then.
That's right.
They need their mental capacity and a good,
Better vision.
accurate shot. Yeah.
Better vision, better
Yeah.
hearing,
Yeah.
better senses. Like fight or flight shifts to what you need, takes away from what
Right.
you don't.
Right.
And you'd find similar in car accidents. Obviously in a car accident, there's a lot going on, but most people who get in a serious car accident, they will void. They will either wet or
Right. Yeah.
defecate because
Yeah.
you're going to have both of it release. Your
Right.
body has to shift everything to protecting you in survival.
And stay alive.
You don't
Yeah.
need, you're going to void.
Right.
I think that would happen if the lion jumped over the fence at the zoo. I threw that example. I know I would wet my pants if the lion. I'd do worse. I would need some new underwear. But that's going to cause that reaction. And so, the bedwetting, when that comes in on the form for a child, we think serious breathing problem.
Yeah.
When I see bedwetting, night sweats, nightmares, lots
Yeah.
of movement, the things we're going to get into a little more, I hear bedwetting, I hear serious breathing problem.
Yeah,
Because
yeah.
to want to void that much fluid that fast, I feel like you're in a category where you got a serious problem, like a SWAT team member being in a gun battle or a car accident or a lion. That's not a mild problem you have. You got a serious problem.
Yeah.
Not a mild condition.
Yeah.
Yeah.
So let's change gears here. Let's talk about night sweats. Okay.
Yes.
So I know women go through menopause, and they have night sweats going through menopause. Is that something for our grown women out there that are listening to this and they're going, night sweats? Can that be something totally different that has to do with hormone changes, or is there still a sleep component in that?
So when I hear night sweats, and we're talking about this population of women in menopause, it's possible that with hormonal changes you could have that, but it would also trigger. Well, we should do the diagnostics and workup to
Yeah.
rule out a sleeping breathing issue.
Right.
Because why wouldn't we pursue that?
Sure.
And so we would take a look at the patient and get, okay, here's our diagnostic records. We got to take some X-rays. We got to do some scans. We got to do some measurements. Then maybe a sleep study is a good idea. Then you go to the ENT for a nasal scope to look in there because they have a best view of things. If you did the full workup and you could rule out and say, hey, this patient took a sleep study. They don't even snore. They have beautiful sleep credentials. We went to the ENT. They don't have a deviated septum. There's nothing in there blocking any of the air. They fill out questionnaires so we learn about their symptoms. They don't have any. And they measure well, meaning, hey, they have good jaw growth and development. If you rule all that out, well, you got night sweats for a different reason.
Yeah,
And
right.
maybe then that's where we would go with it. But I would want to take all those records and work on that diagnostic setup to determine, is this part of all
Yeah,
of it, some of
right.
it, none of it? That's how we would approach that.
And for women that are thinking, I need my hormones changed, or I need a different regime because of the night sweats, maybe before they do that, maybe they should be checked out. Are they breathing? Are they sleeping well? Because they could be changing their hormone regime over and over again to no avail if that's the reason they're...
It's another great example of treating the symptoms.
Right. Yeah,
So if
exactly.
you're treating the symptoms. If you're treating the symptoms, you have a pathway and an outcome that's different than treating the cause, which is why you look at everything. So when we have patients tell us about night sweating, we start thinking about, okay, let's check your anatomy because we want to see about the jaws. Are you underdeveloped? Do you have all 32 teeth where they belong? Because most adults don't.
Yeah.
We are so far past having that early, natural primitive diet. We're 7 generations into industrial
Right.
Western living.
Yeah.
So
Well,
kids,
nowadays it's like a rite of passage to get your wisdom teeth out.
Get your wisdom teeth
You're
out.
just
Most adults
Take
are
'em out.
missing them, yeah. So now you're down to 28 teeth, and if you had some orthodontics where they took out other teeth, you could be down to 24 teeth.
Yeah.
Well, the less teeth you have, the less room you have for your tongue and the less room for air.
Right.
So all of a sudden you're in a pathway where you're probably not a good breather. Well, if you're not breathing really well through your nose and your sleep isn't perfect, that's a pathway to night sweating.
Yeah,
So we
yeah.
would want to go down that road. And it turns out because, if we're talking about women in this age group, well, they'll have children and possibly grandchildren, depending upon, well, they were still in an industrial lifestyle going
Yeah.
back 1 and 2 generations
Right,
ago.
right.
So 1 and 2 generations ago is 20 to 40 years ago. Oh yeah, early soft diet, and then of course the weaker musculature, the underdeveloped jaws, maybe the wisdom teeth are gone. There's less anatomy here, poor breathing, and it's a symptom.
Yeah.
Because I treat mostly children and some adults, in the kids who come in, we have these questionnaires because we want to ask these things because they're related. They're downstream symptoms of poor breathing at night.
Mm-hmm.
One of the things we ask about, like obviously we covered bedwetting already, but the night sweats. And we ask about it, does your child sweat? Is the pillow wet in the morning?
Yeah.
Are the sheets wet in the morning? Because, you'll have parents and you start talking and you hear like, we keep the air conditioner nice, like it's not an oven. We don't sleep in ovens, like
Yeah.
we got normal. We're not putting the winter blanket on them in the summer even, like it's a sheet or there's no
Yeah.
sheet, they kick them off and they're still sweating even though the room's cool. It's not about the temperature in the room. It's about what the body is going through.
Mm-hmm.
And we did touch on it in the bedwetting category that, sweating is the body's way of controlling its temperature. And a human being, temperature is regulated very tightly. It's a small range
Yeah.
in the temperature range. Like you've got a 98.6, we talk about being like an ideal temperature, a normal body temperature. Well, it doesn't take a whole lot of temperature increase to trigger sweating.
Right.
And so some people know they step outside on a day like today, a beautiful day in Dallas today, if I walk 10 steps, I'm going to start sweating. And others, maybe they have to run 10 steps or maybe 100 yards before the sweating starts. But the moment you start to increase your body temperature, your body's going to look to control that because there is a temperature when it gets too high, you're in big trouble.
Right, right.
So just the same way there's an oxygen level when it gets too low, you're in big trouble. Well, temperature is regulated very tightly as well. So when a child lays down to go to bed, if their systems aren't running perfectly and all of a sudden you have the little bit of fight or flight kicking in for the poor breathing. So the early soft diet delivers the underdeveloped jaws, delivers the poor breathing, delivers a reaction to improve the breathing, which is in the fight or flight category. And next thing you know, part of that involves your heart working harder, pumping the blood faster. Next thing you know, you've got this change that increases your body's temperature. And one pathway to reduce body temperature is night sweating or sweating at night.
Yeah.
Pillow's going to be wet, sheets are going to be wet. And there isn't a real good solution in the temperature control, type of pajamas, type of sheets. Those are directions we would think about. That's treating a symptom.
Yeah.
Hey, we're sweating at night. Let's make the room colder. Let's take the blankets off. Let's use less pajamas. Never mind that full hoodie footy that you could put on that looks like a cow that you can,
Yeah.
it's cute to look
Yeah,
at,
yeah.
but it's not necessarily the best thing to sleep in. You could do all of that and find that we're still sweating at night because, well, attacking the symptoms is a different category.
Yeah.
So same thing like in the bedwetting category. When we see parents check off the box, yep, night sweats, whether it's once a week, twice a week, because we do ask, is it, rarely or is it often? Some of the kids come in, it's a couple nights a week. Others come in, it's every single night. The pillow is soaked in the morning. We think about that as a symptom that is significant and related to poor breathing while sleeping. And that child needs attention in the jaw growth and development category
Yeah.
if we're going to be treating the cause.
Do you see night sweating and enuresis or bedwetting together? Or is it usually one or the other, or can they occur synonymously with each other?
Yeah, so I've never gone as far as to ask at the same time. In other words, we have forms that parents fill out, and a lot of parents will check off night sweats and bedwetting.
But they're not
But
necessarily
to be
happening
honest,
at the same time. Yeah.
So to be honest, it wouldn't be accurate if I was going to say that it happens at every single night, because when we start asking about bedwetting, some kids bedwet once a week and others 5 nights a week.
Yeah.
And the night sweats, I don't usually ask, is it every single night or not? We might ask rarely or...
Yeah.
So I'm guessing there's some overlap.
Yeah.
So I'll say it's totally possible to have both. And if you're bedwetting 5 nights a week and you are having night sweats, chances are you're doing both more often than not.
Yeah.
If you're once a week with bedwetting and once a week with night sweats kind of thing from parent response, what we might ask them to do is pay closer attention over time for the night sweating. In other words, go feel the pillow. Because if the kid hops out of bed, you know if there was bedwetting.
Yeah.
But you don't necessarily know if the pillow was wet, and if you check it later in the day, it'll dry. So if we had someone tell us and we want to learn more, we might ask more questions. So yes, you can do both. You could do one or the other. It could be a mixture. Either way,
Okay.
you have someone who is struggling to breathe well
Yeah,
at night
yeah.
thanks to their underdeveloped anatomy.
Right. All right. Thanks, Ben. That's a lot of good information. So, mom and dad, if your child is bedwetting, there's a solution, and it's not, don't give them any liquids 6 hours before they go to bed. That's not the answer. There's a logical reason for that, and I think Ben did a great job of explaining that. So, great job, Ben. Thank you so much. So it's going to help a lot of people. We'll see you next time. This has been Health and Harmony Beyond the Teeth. I'm Hal Stewart, your host. And I just want to say thank you for being with us and letting us share our knowledge and do something good for somebody today. Might be the only person that ever does anything good for them, and it might change their lives. You never know. We're signing off now. See you next time.